marma point. This is the Kurcha Shira marma. These are the two marmas or the acupuncture points as well. This is, but however, this also considered as a two different marmas which is located on this region. You, when the patient having the respiratory distress or the respiratory problem, so that time they says, ouch. This is a very pathetic pain in this particular region. Once you give the pressure, the people who have the thyroid related disorders, at the same time they do have like a, apart from thyroid, they have the lungs related problem. That time definitely they says the ouch, I do have the severe pain. So that itself is the therapeutic point to treat for that. If the pain, just give the pressure in the same level the patient feel the pain, absolutely not like that. The patient is getting the pain, then you find out the tenderness on that specific area and then give the mild to moderate pressure. हल्का सा प्रेशर दियो फिर रिलीज करो, प्रेशर दो रिलीज करो, प्रेशर दो रिलीज करो. इसका मतलब जेंटल प्रेशर देना है, बहुत डीप प्रेशर नहीं देना है. डीप प्रेशर आप हमें कोई भी बिंदु को देना बेहतर नहीं है. ठीक है. So Manibandha Marma. So Manibandha Marma is the really good point to treat for the numerous diseases. Manibandha Marma controls the skeletal system and then movements of the hands and the lubrication of the joints and the peripheral circulation. How to do that procedure? So you just do one thing and then place your Manibandha. You just hold like this. When you hold left hand with the with your with your yes with your right hand and index finger is outside, at least the middle finger and then your thumb is connected to the Manibandha Marma. When you hold precisely tightly and then activate this Manibandha, that you are activating to the entire joints, the wrist joints. This is really good, not only related to the Manibandha for the lubrication of the joints and also peripheral circulation means is the circulation of the body, right? Whereas in controls the skeletal system and movements of the hands. So you just activate this point. However, this point is located on the darling point where the P7. But you just activate this point, not only one point, you are focusing to the entire wrist region. So we ask them to give the pressure. 1, 2, 3, 4, 5. Relax. 1, 2, 3, 4, 5. Relax. Again 1, 2, 3, 4, 5. Till 10 to 15 times you can give the pressure. And the similar way you just open up this and then again you just give the pressure. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Where are you giving the pressure? The pressure is where is happening the pressure? You just tell me the entire area. Where are you giving more pressure? Which area is the more pressure is affecting? Where are you getting?
P7, sir. P7.
Yes, P7. And also when you touches, so that particular time there are the 2 points, 2 tendons also activating over here. One is the good. One is the LU7 rather than LU7. Yeah, of course, LU7.
Sir, I feel on the knee.
Sorry?
Sir, is it on the knee? I feel something on the knee near the patella when I press this point.
No, are you giving pressure on the knee region or on the hand?
No, on the wrist region I'm giving pressure, but I feel some sensation on the knee.
Oh, knee region. I think
yeah.
Getting some vibration or some kind of the urja is getting changes on that region, but however it getting the changes on the ligaments and of course this is especially useful for the joints. But now once I do this kind of the pressure, so that time I am giving the pressure on SI5 and then LI5 and then LU8 and 9 region. Of course that entire Manibandha is the when the friendship day comes. So that time they will not be. Money in the sense is joints for money. Yes, sir. Banda in the sense entire joints they are holding. Banda in the sense holding. Holding. So the entire is money for the joints. Entire all the fingers. Yeah, all the fingers. Here also joints. So you just press it. You press it and you feel the difference definitely. We ask them to give the pressure to people who are suffering for the wrist arthritis and also finger arthritis, joint inflammations. Especially this also keep it in your mind how the shipra of the leg. I told you that is called as a liver too. So in the similar way, this also good to treat for the skeletal system disorders. Right. Indrabasti Marma, Indrabasti, there are the two Indrabastis are there. One is the leg, the second one is the hand. This is a very important marma. Please keep it in your mind and practice in your clinical practice and advise them to patient to do this procedure. One is the Indrabasti. We will start first from the hand. Indrabasti. Now we will do it on the hand first. Now, how to measure? Try to understand the tunes. Finger measurements are slightly different from the marma. Now, you understand the tune means is the one proportional inch or the one maximum interphalangeal joint of the thumb, known as a one tune. This is one tune. But now, in the marma, to be considered as a angula. Yes, one angula is nothing but this is one angula, this is two angula, this is three angula, this is four angula. Right. Yeah, inches, but now four angula according to the TCM. So this considered as a three chune, but according to the marma is the four fingers. So there is no chune or measurement, but they consider as a char angula, do angula, panch angula, das angula, bara angula, like that. So now you can measure the or you can measure the fingers like this. So 4 angula distal to the center of the cubital fossa. Remember, this is a very important marma. Indra Basti, keep it in your mind. So you just place it the four fingers from the center of the cubital fossa, which is a you put few drops of the water, when you put it some amount of the water on this, on the elbow, when the water gets retention on that region, that to be called as a cubital fossa. This is a suprasternal fossa. Like that, this also cubital fossa. From here, 4 angula, 4 angula distal to the this is cubital fossa in the center. So this to be called as a Indrabasti marma. So this marma is really useful to treat for the mainly this will be useful for the urinary bladder related diseases, UV related diseases. To be related means generally keep it in your mind. Above 50 years, the people who are suffering for the urinary incontinence or the urine outflow is more or less or the retention of the urine, polyuria, BPH, and prostate gland hypertrophy or the prostate gland cancer or the post-void and pre-void urination is accumulated in the urinary bladder. In that particular condition, and remember, you just use this four things. Non-visible in the screen is not visible. So you can see my hand in the Zoom.
No, sir.
Please comment yes or no.
No, sir.
No, sir, no, no, no.
No?
No, sir, nothing is coming. This camera.
Was nobody concept the chat?
Yes, sir. Yes, sir. Yes, sir. Yes, sir.
Good. Now we try to understand about the Indrabasti marma. There are the two Indrabasti. One is the hand, the other one is the leg. Right? Hand Indrabasti. You remember that this has been told the digestive system and other systems, juices and all small intestine that will going to affect. But however, one point for the multiple purpose. So as per my clinical experience and also according to the marma, so here is recommended to give the pressure on the specific region for the urinary bladder. How? There are the sun in Chio. Spleen 6 point is recommended. Spleen 6 point is good point to treat for the pelvic disorders. In the similar way, here also there is the marma that is called as the Indrabasti, the hand marma, char angula, distal to this on the exactly on the tendons, palmaris longus and flexor carpi radialis tendon. You just place it 4 fingers. I think I'll show you again. This is the popliteus, this is the cubital fossa. From here, 4 fingers, you just place it, and then where the after the fourth finger, you can find in the central. From here to here is the center. So this center, ask them to give the pressure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Relax. Don't lift the thumb. Again, you just give the pressure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Relax. Again, you just give the pressure. If you don't want to count, press and then release. Press, hold it for a few seconds and then release. Press for few seconds and then release. Press few seconds and then release. So press few seconds and then release. This is called as the Indrabasti marma. Right, this really good point to treat for the what condition? Generally, urinary related disorders and also the digestive related disorders. Now, Indrabasti marma, which is connected to the leg region, where precisely this point is located. You remember that there are the 12 angula, 12 angula superior to the from the sole of the foot, where the Achilles tendon starts. For example, now you just see that. So this is the calcaneal bone from the sole of the foot or from the calcaneal bone where the Achilles tendon. From there it goes. This is the forangula. Again it is the forangula. Again it is the forangula. Ultimately this divided into 12 angulas. But it shows the figure is slightly upper level. The forangula and then forangula. Totally there are the 12 angulas superior to the posterior side of the Achilles tendon. From there on the where the bellies of the GNM gastrocnemius muscles covers over that region. So that particular area to be known as a is the Indrabasti Varma, but this point to be called as a Cheng Shan in Chinese. Cheng Shan means UB57. UB57, this point is good point to treat for the hemorrhoids and digestion and also for the urinary related disorders. So especially both the points you can recommend, otherwise you can recommend the one point, you can recommend the other point. So one point is on the here. So which one will be the more comfortable? You can use it, but I recommend when the patient is complaining about the anything is the digestive related disorders, you can activate this Indrabasti of the leg. You wanted to activate this, you can activate the Indrabasti of the hand. So you just note down this. I commit you within 5 minutes. I'll be back, and you just note down this and try to understand where the point is located. Further, I'll tell you exactly what about this, what are the physiology about this particular point, how the pressure to be given to this particular point. This really very important. Purpura karma or purpura varma. You just note down the notes, and then I'll be back within 5 minutes. So I'll show you how to do this procedure. And then first you place it. Try to find out the ulnar bone, the olecranon process of the ulna. You know this. This is the lowest, longest bone here. You just place it the thumb. You just place your thumb, and then you just take your this index finger, place it on the cubital crease. You just place like this. This is, and then place this your index finger on the cubital crease. On the cubital crease, you just where the LI11 point is there in this side, you just place it on the line. This middle finger, first you place it this, and then middle finger place it on the cubital crease, and then without much expanding your fingers, and then place it your middle finger. Place it your middle finger. Then where the middle finger is connecting, that point known as a kurkura varma, and then give the pressure to this particular region. Give the pressure to that particular region. Then you give the pressure and then relax. Give the pressure and then relax. Give the pressure and then relax. In the same way, you just come to the other hand and then place it this is the thumb, and then this is the index finger on the cubital crease, and then place it this thumb. I mean that all the fingers where the middle finger touches. You can give the pressure with all the fingers, but however the middle finger is the kurpara karma. Middle finger where it touches, that location or that area to be called as a kurpara karma or the kurpara karma or the marma. You just give the pressure and then release. Give the pressure and then release. You give the pressure and then release. But now I'm giving the pressure on my right hand, that indicating to you I'm activating to the liver and gallbladder. When I'm just touching and then activating here on the left side, that means I'm activating to the spleen and then pancreas. Spleen and pancreas. You give the pressure and then relax. Give the pressure and then relax. Everybody is doing in the Zoom. So everybody is trying this.
Yes, sir. Sir, can you show me once how to get the point?
First, you just olecranon process of ulna. You just touch to the olecranon process with the thumb. You place it your thumb
Yes,
on
sir.
the olecranon process, and then this all the four fingers and take it on the anterior, that is the radial side of the hand of the elbow region, and this index finger you place it on the cubital crease where the LU5 and LI11 point is there. So there you place it the index finger.
Yes, sir.
And then you just place it your all the other fingers next to that. Actually, one angula distal to the lateral end of the cubital crease, the ideal location. One angula means this one finger.
My finger. Yes,
One
sir.
finger distal to the LI11, right? Where that area is called as a Shao Sun Li. Shao means is the hand, Sun means is three, Li means unite together or miles. How the Zu Sun Li is there? Zu means is the foot region, Sun means is the three, Li means is the 3 miles. Like that, this also Shao Sun Li. That's the reason this specific point is the very good point to treat for the midway between the navel and then diaphragm. So diaphragm is the epigastric region. From the epigastric region to the navel region, what are the organs are located in this region? So you look at about the liver and then gallbladder, and further it is the kidneys and the spleen and pancreas. All are connected to the navel and then diaphragm. You look at this entire region to be covered by activating by Kurpara Varma. You understand? The patient says, I do have the digestive related issues and gastric issues, bloating issues, how the people consume like a proton pump inhibitors and other things. So definitely we recommend them to give this kind of the pressure continuously. Right? Every now and then let they give the pressure continuously. Definitely they have a lot of changes in their abdominal system. So this is outer purpura, this is the inner purpura. But inner purpura, now you wanted to see that inner purpura is how, where is the location. So now you understand angula, one angula distal to the, one angula distal to the H3. H3, where the point is located, midway between the medial end of the cubital crease and the medial epicondyle of the humerus. So that point is H3. This is H3. One angula below, that's called as the inner. You place it like this. You place it like this and then give the pressure 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and then release. Again give the pressure 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You just release. So in this way you just keep activating the outer purpura and then inner purpura can be recommended. So only the most important is the outer one. Most important is outer one. So did you understand? So repeat with me, Indrabasti. Where is the Indrabasti is located?
Cubital crease.
Good.
Near one the outer surface, that is LI11, distal to LI11.
Yes. Indrabasti, I am asking you.
One is H3. One angula distal to H3 is inner one.
Yes, that is the purpura. Whereas in Indrabasti, 4 angula. 4 angula. Then what about the leg? Indrabasti?
4 plus 4 plus 4.
Yes, 12 angula proximal to the
Achilles tendon.
Achilles tendon on the posterior side of the leg. Good. Then urbi, arm, marma. Ravi or the urbi, arm, marma. So this controls the plasma and water metabolism and vayu and governs the healthy tissue growth. So what is the plasma? What is the blood and what is the plasma?
Plasma is in the liquid form. It flows in extracellular part that.
When you separate the blood cells, the remaining portion of the fluid known as a plasma, where there is absence of the blood cells. Right. That also really important to our body, which we call as a PRP therapy. The plasma replacement therapy, something is the COVID time they were started that plasma therapy will be successfully treated for the COVID patients, right? So in that way, this is in fact is the Urvi Marma. We'll try to see where the point is located. Right now, this is very good point to treat for the asthmatic conditions. Now, 4 उंगला नीचे, अभी 4 उंगला ऊपर, 4 अंगुला ऊपर from the cubital fossa. You just place it like this in the center. In the center, try to find out the middle finger. So how the middle finger is coming in the central line, you just come from the middle finger line from here 4 angula upper, this point to be known as a urvi of the hand. Urvi marma. Urvi marma of the hand. Give the pressure 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now I wanted to connect to the acupuncture because do you know which is the oxygen point in our body?
LU4?
Very good. LU3, LU4. LU4 is the Tianfu. So this point is where is it located? Again, it
On
is
the biceps of almost on the medial side of the biceps.
So in fact, this also located on the biceps femoris, biceps muscles of the hand, but they at the same time the marma also says the चार अंगुला ऊपर यहाँ पे चार अंगुला ऊपर slightly because this is connected to the pericardium meridian, this connected to the lungs meridian, but lungs meridian also comes in the same region, slightly changes. थोड़ा सा अगर साइड में लेके जाते हैं so that to be known as is
not visible, sir.
Urvi.
No, a hand is not visible.
Yeah, it's all right. I'll show you now. See, now we understand about the marma, understand about the lung meridian. Now you just see this meridian is the pericardium meridian. See, this is the depression. Where is the pericardium 3 is located? The medial end of the cubital crease. Medial end of the cubital tendon, not crease. This is the cubital bicep tendon or the cubital tendon. Two names for this. So medial side of the tendon is pericardium 3. Then you place it 4 angula upar. And then that to be known as a pericardium meridian. Then where is the LU5? LU5 is the lateral side of the cubital tendon in the depression. You just place it 4 angula and then 4 angula कहाँ पे 4 अंगुला खत्म होता है उधर ही है वो बिंदु. Then you just activate this point on the central line slightly towards the lung meridian, this point to be known as a urvi marma is really recommended to treat for what condition, especially for the respiratory distress, especially for the respiratory problem and the kapha related problem, water metabolism. This can be treatable, and of course this really helpful to treat for the oxygen supplication point for the lung system. When the patient is complaining about the respiratory distress, asthma, breathing difficulties, congestion, shortness of breath, upper back pain, and then skin allergy conditions, definitely we can use this point precisely. Then the another marma which we call as a lohit aksha or marma, so that where the point is exactly located on the armpit. But I recognize rather than marma points, I recognize in the terms of the Chinese names this point to be known as a bai pei, Bipay. Yeah, this is a Lohit Aksha Marma. Lohit Aksha Marma is located on the anterior side of the axillary crease. Anterior side of the axillary crease. It controls the plasma and then lymphatic system, and which we call as a blood, and then Vyana, Vayu, peripheral circulation, particularly to the legs region. But however, this also good to treat for the circulatory system and then lymphatic system. When the patient is complaining about the lymph nodes are existing where the immunity is not good, when there is a stagnation and retention of the blood vessels, anywhere there is the lump is there, so that particular time we ask them to activate this point 1, 2, 3, 4, 5 clockwise and then anti-clockwise where we call as a yellow color here. This called as a marma. So Lohitaksha marma, this always is good for the being this point is in the shoulder region. Even for the shoulder pain also can be treatable by activating this particular point. So where the point is there, this is the point where you can find the, you remember K10, you remember the K10 and pericardium 6, how is the point is located here? Like that the K10 region also on the popliteal crease. So like that here also axillary crease, the medial side of the axilla, you just apply this pressure on this particular region. So this is the region we just activate. This always is good to strengthen the pulmonary system, lung system, heart system, and also to the shoulder brachial syndrome. But of course, it shows that is good for the lymphatic system as well. I think we have done this, right? Kaksha Dharna, Kaksha Dhara Karma, control the muscular system, shoulders and bodily postures, and shoulder vayu related disorders. Which is the point this is? So please show me how do you do this point? Good.
GV 14, that is DU 14, that lateral. UB, yeah, little lateral to UB 11 or 13, like that we can.
No. So this is a GP21, small Sanjo 15, and then SI 13. So that area, but however, this point to be known as the Sanjo 15 we can consider because the GP21 is slightly anterior to this point. But however, you just place it whichever point touches. So that point to be known as this Kaksha Dara Marma. Kaksha Dara Marma. Right, this for the shoulder brachial issues. See, now Tala, I told you Tala Hridaya Marma of the hand. Right, on the hand where I told you? On the P9 region. Now, Tala Hridaya foot marma. That is the hand marma, this is the foot marma. So this point is, where is it located? At the center of the sole of the foot. Right. This is good for giving and receiving the healing energy. Rub gently and apply the pressure. Controls the respiratory system and also heat reception on the skin, the feet as the motor organ. Controls again, it is what are the things which are existing in that particular region. Here also all the indications connected to the all the indications are connected to the circulation of the blood of this entire body system. At the same time, this is the earth element point in our body. Then you understand the K1 is the belongs to wood point. At the same time, the earth point. When you are walking, so that particular time what will happen? That you are communicating to the earth. So when the earth is, you are touching your feet, so that indicating you are activating the earth point. Earth having the lot of minerals, isn't it? Everything, right? Gold also you want to take, you just don't take it. The copper, titanium. So everything, the earth having the energy. That's the reason the mud therapy is the really good therapy for our body detoxification system to be taken place. But however, so this the Tala Hridaya foot marma is good if you activate the 2 points. One is the sole of the foot, and the other one is the palm of the central palm of the hand. So together is what are the indications? What are the indications we can treat? All the indications. Now, yes, you know or you doesn't know about the disease. You wanted to treat for the whole body organs. Then don't take it everything like that. But I'm giving you that much valuable. The sira. How many siras are there?
Only one.
700, right? So that much value can be given to these 2 points. 350 blood vessels is the P8 and 350 blood vessels for the soul of the foot. So whether K1 is not important. Forget about acupuncture here. Is the central part of the soul of the foot. Keep giving the pressure. The Zoom people, you are sitting, you are not showing any camera, you are not executing your face anywhere. But in that case, I recommend you at least you start applying yourself wherever, however you are sitting in randomly at home. You just keep giving the pressure. At least give the pressure on yourself to that particular region you practice. Once you try to see how are you giving the pressure to that particular spot. Coding, coding, just coding. So ಕೊಡ್ತಾ ಇರಿ, you feel some kind of the ನೀವು ಬೇಡಿ ಕಷ್ಟ ಬೀಳ್ದಾಗ shorts ಹಾಕೊಂಡು. So you just give the pressure, something you feel more relaxation I feel, because see, I'm telling you, when I study something, that time I feel it is connected to something is a so crucial important point. I give pressure myself to at least मुझे टाइम नहीं मिलता है, एटलीस्ट मैं अभी दे दूं. So ऐसा आपको भी इतना प्रेशर नहीं देना है. Especially the cardiac neuropathic conditions, please don't give the very gentle pressure, but don't give the deep pressure. अगर deep pressure देंगे कभी भी कुछ भी हो सकता है, उसका कुछ भी इन्फेक्शन होकर फिर फर्दर गैंग्रीन में जा सकता है. इसलिए आप बहुत ही हल्का हल्का प्रेशर देना बहुत जरूरी है. अभी पता चला इट इज फॉर द ब्लड सर्कुलेशन ऑफ द एंटायर सिस्टम ऑफ द बॉडी. तो अभी एक बहुत महत्वपूर्ण पॉइंट आपके सामने आ रहा है. कुर्चा, कुर्चा हमने हाथ में देखा था. कुर्चा भी बोलते हैं, कूर्चा भी बोलते हैं. कूर्चा फुट मर्मा, कूर्चा हैंड मर्मा. सो ये बिंदु मिडवे बिटवीन द लिवर 2 और लिवर 3 के बीच में ये बिंदु है. इस कंट्रोल्स द आलोचका पित्ता, seeing the power of the eyes, overall sensory acuity and then prana vayu. So vayu, prana vayu के लिए भी काम करता है और seeing power of the eyes also. You just see how is it correlating to the acupuncture and then marma collectively. ये हम लोग liver 2 is the fire point of the liver के fire को अगर relieve करेंगे, the fire is opening to the eye system. जब fire नहीं है तो darkness है. Darkness is there, due to that reason you can't see precisely. When there is the brightness is required, what is required? Fire is required to see. So when the liver fire you just open the eyes and improve the overall vision. So therefore liver 2 and liver 3 area, that's called as a kurcha of the foot marma. So इधर अभी क्या करेंगे? I think I have written one article last Tuesday. So every fortnight, every 15 days once, my article is coming. But in fact, for the last 4 times, I have written the diabetes article continuously. 4th article is diabetes article, and one more will going to complete the article in the 5th article for the diabetes mellitus. Let's in future, I will try to translate in English. Then we will try to post if the situation permit me.
So where can we find that article, sir?
No, article is in Salar Urdu paper. No, Salar daily Salar Urdu paper. That is actually Urdu. So because those given me the opportunity to write the articles, that's the reason I am writing. For the last more than 7 months I am writing the articles, but fortnightly the articles are coming. But 4 times I have written only related to the diabetes. Why I mean to say, I have shown this point for the diabetes control as well. So to control the diabetes, so this point to be activated. There are the 3 points to control the diabetes at home. So you understand, first time I have given the 3 points collectively. One point is the NEEC 1, that is pericardium 6. The second point is Saningio, that is spleen 6. The third point is liver 3. These 3 points are good point to control the diabetes at home. But however, you understand I have written 4 article means I have given the lot of reasons why are you getting, why the children, especially the teen, that age is mid age. The people diabetes will come after 50 years. We used to listen 50, 60 years later diabetes used to come. But these days 30 years, 40 years, women are the male or female are affected to the diabetes mellitus. What could be the reason? I have mentioned the entire reason for that. On that only one article, one more author is started writing the one book, entire book related to that. So I think that was really quite interesting. You also will going to learn that, and you can implement that in your clinical practice. So this kurcha, foot marma, whenever you find the time, you just give the pressure. For the vision related problem, you don't get the time. At least you just give the pressure whenever you have the opportunity. Myself is taking the treatment at the cost of free, giving the pressure on this region. At least try to get some vision changes and also may increase the liver energy. Isn't it? Are you doing? Everybody is doing? Please tell me yes or no. Everybody is practicing this?
Yes, sir. Yes,
Yeah,
yes, sir.
practice. Whenever you get the opportunity, practice. So once you practice, no, later to telling to others will be super simple. Purcha, Shira, foot marma, I think we have completed right now. Muscular system, particularly muscles of the foot and bodily postures like the Purcha, Shira and marma is good for the Agni and then for the digestion. So of course you understand this is for the hand and also the other one is in the foot. Both together is good for the muscular condition as well. So Gulpa Marma controls the fat and bone and reproductive system and the circulation of the prana and then lubrication of the joints and movement of the feet can be taken place. Where this point to be located? This point to be located on the Gulpa K6 region. Where is the K6 is located? One tune or the half tune distal to the center of the medial malleolus. Right. This the gulpa is good for the joints and then movement of the feet. And also this controls the fat and then bone and reproductive system. Because the K6 the point is the kidney 6 is the point. Right. But don't say here is the K6 is the gulpa. Gulpa marma, how to remember? At least you correlate and then remember. So controls the fat. Number one. Number two, the bone and reproductive system. Kidneys are controlling to the bone. Kidneys are regulating to the reproductive system. Right. And also lubrication of the joints and movement of the feet. The patient is complaining about the heel pain and the movement disorders or the joint pain or the heel knee pain or some amount of the cervical pain. So all are related to that. Definitely you can ask them to give the pressure to the gulpa. So otherwise you just knee pain is there, ask them to give us a liver 3 which I told you is the superior one which we called as a kurcha foot marma. Kurcha foot marma is always is good. Kurcha Varma, liver 3, liver 2, midway between that. Right, Gulpa Varma is K6. Now Indrabasti already I think we completed this. Janu Marma. This also very important. I think it's very super simple. Controls the lubrication of the joints, circulation to the legs, and right knee marma controls to the liver and ranchaka pitta, coloring of the blood and then bile. The left knee marma controls to the spleen and pancreas, right, and then water metabolism. right for the liver, left for the spleen and pancreas. Right knee pain is related to the liver, left knee pain is related to the spleen and then pancreas. How super simple. Every time you will going to learn something new and new and new and new and new, isn't it? Yes or no?
Yes, sir.
बोलो ना प्लीज.
Yes, sir.
अभी पता चला आपको राइट नी इज रिलेटेड टू द लिवर, लेफ्ट नी इज रिलेटेड टू द स्प्लीन एंड पैनक्रियास.
Yes.
मैंने बोला था जब पैनक्रियास मेरिडियन इज द राइट मेरिडियन, राइट, एंड देन स्प्लीन मेरिडियन टू बी नोन एज ए लेफ्ट मेरिडियन, वो मैंने कहा था. लेकिन नी पेन is connected to the right side knee is related to the liver, left side knee is related to the spleen and pancreas. जब आपको लेफ्ट नी में दर्द हो रहा है, then you can use the distal point for the knee pain by using the spleen 3, thigh Y. When the pain is on the right side of the knee, pain is there, use the liver 3 is the shoe stream point. क्योंकि liver 3 P6 and liver 3 is the super formula to treat for the knee pain. मगर आपने नी पेन अगर लेफ्ट नी पेन है तो उसके लिए आपको लिवर 3 नहीं लगाना, क्या लगाना है? स्प्लीन 3 लगाना है. ठीक है, that is a different thing, but now you can ಇದೇನಾ ಅಲ್ವಾ ಯಾವಾಗಲಿಂದ बहुत अच्छे स्टूडेंट्स ಹೌದು. ಏನಪ್ಪ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಟರ್? सरी सरी सरी. अच्छा, उसमें जो आप लोग उसमें खेलते हैं, फोन में खेल रहे हैं, ठीक है खेलो. नो जानो जानो वर्मा कहाँ है? पॉप्लिटियल फोसा में जानो है आपकी. जानो पॉप्लिटियल फोसा popliteal fossa, center of the popliteal fossa में actually
liberate.
no liberate. आपको मैं बताता हूँ. Actually this is jano marma is located is the anterior and then posterior, दोनों में भी है. The superior border of the patella, then posterior side of the center of the popliteal fossa. आपको दोनों में ये जानो मर्मा है. अगर किसी को नी पेन हो रहा है तो लोग अटेंडर के साथ आते हैं अक्सर. अटेंडर को कान पकड़ के बिठाओ, फिर बोलो के बैठो, फिर मरीज को सुलाओ उल्टा, उसके बाद फिर आप नीडल लगाओ, फिर होने के बाद उसको नीडल लगाने के बाद उसको निकाल दो, मार्क कर दो और अटेंडर को बोलो यहाँ पे प्रेशर दो. अगर आपके डैडी ठीक होना है, आपको सुबह शाम 5-5 मिनट प्रेशर देना. उसको पूछो ठीक होना है या नहीं ठीक होना है, वो बोलता है ठीक होना है. पूरे हमारे सर के ऊपर डालता आपने, उसके सर के ऊपर वापस डालो. तुम करो ये काम घर में, ठीक है? बोलेंगे आप सच में जूम में बोलो?
यस सर बोलेंगे, क्यों नहीं बोलेंगे.
वो तो आते हैं हमारे पास, हम ट्रीटमेंट करना है, लेकिन आप उसको थमा दो कि आप उनको खुद भी करने के लिए बताइए. तो इस बिंदु को एक्टिवेट करना है. आपको पॉइंट्स अगर लोकेशन समझ में नहीं आ रहा है कहीं पे भी, आप लोग फिर आवाज उठाइए, फिर आप पूछो, मैं जरूर वापस आपको बताने की पूरी कोशिश करूंगा.
I want that point location, sir, because
this one
it looks. Yes, sir. Point location, please tell no, sir, once again for this.
UB40 you can able to see at the center of the popliteal fossa. आपको जब आप खड़े रहना है या फिर लेटे रहना है. लेटे के बाद you just try to find out is the center part. Now I'll tell you there is a diamond shape एक hollow होता है back of the knee. और कुछ लोगों को एक coin होता है, एक cyst होता है, that cyst known as a popliteal cyst. अगर दूसरा नाम है बेकर सिस्ट. सो उसको एक्टिवेट करो. उसको जिस जगह सिस्ट है वही सिस्टी आपको पॉप्लिटियल फोसा को सेंट्रल पॉइंट है, वही तो जानो है, ठीक है। वो मर्मा को एक्टिवेट करो। फिर एंटीरियर रीजन आल्सो देयर इज द मर्मा। अगर किसी को भी कुछ भी दर्द हो, अगर राइट नी में लेफ्ट नी में, बायलैटरली इट इज रिकमेंडेड टू एक्टिवेट। अगर आपने बायलैटरली करेंगे, राइट में करेंगे, तो फिर आपको साइन्यूस स्टिमुलेट हो जाएंगे। अगर लेफ्ट में करेंगे, द फ्लैशेस which controls to the knee region, उसके लिए भी सपोर्ट मिलेगा, ठीक है। सो अनी लेग मर्मा, दोनों अनी लेग मर्मा, अनी हैंड मर्मा, ये दो मर्मास हैं, ये पीछे के हिस्से में हैं। यू जस्ट सी दैट। सो कंट्रोल्स द उदकवा स्रोतास, वाटर मेटाबॉलिज्म and also circulation of the bodily fluids and movements। ये भी आपके लिए, अगर hamstring muscle से, मैंने कहा था एक बार, अगर 6 fingers above, 6 fingers 6 अंगुली ऊपर आपको एक hamstring muscles का मोटर पॉइंट मिलता है। सो long back I told, सो ए भी इसी तरीके से नियरली आके 5 to 6 अंगुला ऊपर देयर इज अ सेंसिटिव स्पॉट है। उस स्पॉट में आपको एक प्रेशर देना है। अगर पेशेंट कहाँ पे फील करता है दर्द हो रहा है, तो उसी बिंदु को आप एक्टिवेट करना है। either you just apply the pressure or the needle or maradana, or you just use some oil to apply to that specific region। अभी हम बता रहे हैं कि अगर अपने को मुश्किल हो रहा है प्रेशर देने के लिए, या मरीज को खुद तकलीफ हो रही है, या अटेंडर को तकलीफ हो रही है, ऐसे सिचुएशन में जब आप कुछ ऑयल सप्लाई कर दो, मस्टर्ड ऑयल हो या सीसेम ऑयल हो या फिर दूसरा कुछ कोकोनट ऑयल हो या विर्जिन ऑयल, यू जस्ट अप्लाई और उस रीजन को मसाज करना है। अगर कपिंग थेरेपिस्ट हो तो फिर उसको प्लास्टिक कप्स ले लो, लेके फिर उस हिस्से में आप मसाज भी कर सकते हो। छोटा कप्स आते हैं और मीडियम साइज, स्मॉलर साइज, मगर आपने स्मॉलर साइज कप्स को ले लो, फिर उसको तेल लगाकर उस हिस्से में मसाज करते रहिए, तो जरूर फायदा होगा। ये बिंदु नी पेन के लिए भी जरूर फायदा होता है, स्पेशली द हैमस्ट्रिंग मसल्स का अगर टाइटनेस हो जाता है तो उस वक्त में नी में दर्द, पोप्लिटियल फोसा में दर्द होता है। लेकिन इसके साथ ही साथ यू अंडरस्टैंड, इफ देयर इज द पेन ऑन द हैंड, this point is located on the triceps muscles। अगर triceps muscles में कहीं पे भी shoulder pain, the back shoulder pain हो रहा है, especially on the small intestine region, so वो हिस्से में पूरा दर्द है, वैसे कंडीशन में इस अनिमर्मा को यूज कर सकते हैं। देन उर्वी लेग मर्मा, सो ये बिंदु 3 चोन और द 4 अंगुला फ्रॉम द टिप ऑफ द पैटेला, 4 अंगुला above from the tip of the patella, ये controls the plasma, water metabolism and also kapha dosha and water element in the body as the whole। especially ये जो urvi leg वर्मा है, so this really helpful to treat for the pain of the knee pain which is superior। हमने बता दें कि quadriceps muscles का मोटर पॉइंट्स 2 होते हैं। ये का के सेंटर ऑफ द फ्रॉम द स्टमक 30, फ्रॉम द स्टमक 31, ये स्टमक 31 है, तो फिर ये पैटेला नी है, इसका एंटायर बीच में, तो ये सेंटर आके क्वाड्रिसेप्स मसल्स का मोटर पॉइंट है। इसका आधा हिस्सा यानी वहां से नी के बीच में, then further this to be known as a urvi leg marma। this also good point to treat for the various condition of the leg pain। अभी बस्ती मर्मा, basti means is the urinary bladder, so basti controls the muscular system and also bodily fat and also kapha and urinary reproductive system। so and then second chakra swadhisthana chakra and kohunali relates to the vata sites of the accumulation in the large intestine, which is located in the peripheral to it and then up to aparna vayu। so this marma, basti marma, is where is it located? On the tantian area, on the tantian area, this Basti marma is located. You understand this, the Basti marma is good marma to treat for all the urinary bladder related disorders. ये मर्मा बहुत बड़ा है, ये मर्मा छोटा नहीं है. This is the larger zone, larger area, not only on the ventral side and also this horizontal level में ये पूरा मर्मा है. इस मर्मा को अगर इस तरीके से एक्टिवेट करते हैं, नॉर्मली आई रिकमेंड द पीपल हु आर द प्रोस्टेट ग्लैंड रिलेटेड डिसऑर्डर्स, सो दैट पर्टिकुलर टाइम हमने बोलते हैं इसको प्रेशर दो. व्हेन यू गिव द प्रेशर, सो यू आर गिविंग प्रेशर टू द ब्लॉडर. जब ब्लॉडर में जब पोस्ट वाइड एंड प्री वाइड रेसिडेंस यूरिनेशन अक्यूमुलेशन हो जाता है, ऐसे कंडीशन में उसको पुश करना है. कब पुश करना है? when they go for the urination, so that time you just give the pressure. When you give the pressure which is accumulated in the bladder, that gives the force to the urethra to pass out the urine. जब ये with that particular moment, without that time when we are sleeping, that particular time also recommended to give the pressure to this marma, that's called as the Basti marma. Right. So Nabi Marma, I think I told all about information, controls the third at the navel. Chakra as the Manipura chakra. Vishodhara Nadi as the well digestive blood and circulatory system. Mani pranic center for the digestion and exertion. Controls the Agni, digestive fire. Right. And also digestive juices and the coloring of the blood and bile. And also balancing the energy, pitta, dosha and other fire element in the body as a whole. Oh, Hirdaya Marma. So Hirdaya Marma, where is it located? At the center of the sternum. Center of the sternum. Hirdayam Marma, which is located not midway between the two nipples, but above the nipples. Where is the sternum? The sternum starts from on the first intercostal rib below the suprasternal fossa. From here to here is the sternum. Then the center. Run 17 के ऊपर you just activate this point. This point is Hirdayam Marma, controls the plasma, blood and circulatory system. And of course this overall when we look at about the strengthening as a immunity and a lubrication for the heart and the lungs. Right. And also aids in the flow of the breast milk. The heart is the seat of both the mind and then consciousness, the higher self or the Atman. It is the region where our awareness dwells during the state of the deep sleep. It calls the pranic and soul forms of the Agni. Nitamba Marma. So Nitamba Marma is located where the GB25 area, gallbladder 25 area, posterior region. This marma is there. Lymphatic system, bodily fat, skeletal system and urinary system related disorders. So this is as well as the kidneys an important kapha point. So Amsa Marma, how many? Still more? Oh, it's over. Asma Marma controls the fifth or the throat chakra. Asma Marma. This Asma Marma, it looks like a back, but of course it looks like a Vishuddha. This is the Bharajaka Pitta, heat absorption on the skin. But this Amsa Marma is you.
ಹೇಳೋ ಎಷ್ಟು ಚೆನ್ನಾಗಿದೆಯಾ.
ನಾ ಚೆನ್ನಾಗಿದ್ದೀನಮ್ಮ.